Good evening, everyone. It's about 7 o'clock on my watch, so let's start. We've still got Rochelle and Adrian missing, but it's 7 o'clock, so let's go. As far as I know, we have no apologies for absence. We're all here except the two of them. Can we look at the minutes of the previous meeting on page 5 to 8? Are you happy that I sign them as a correct copy of the meeting?
Minute 10, the committee considered the forward programme and that it be noted there wasn't a forward programme to look at. And you said something would be sent round by email. At OSM, we raised concerns that there was no forward plan for HOSC. At the HOSC meeting, it was a very short meeting, 35 minutes, 2 items, and we didn't have a forward plan to discuss.
Okay, so we did have an agenda in the forward programme, but I think you didn't have the opportunity to discuss it, but I can certainly amend the minutes.
We didn't have a programme of what was proposed to be on each agenda of the meeting in the coming year.
Sorry, I'm just looking at the agenda that went to the June meeting, and there is a forward programme that was included. It's not fully populated, but there was a forward programme.
We did discuss the coroner service issue on it. Adrian brought up.
That was raised.
Yeah.
Not that it was on the forward programme. We had the standard items, but nothing had been programmed at that point. So I just think the minutes aren't a true reflection.
That's no problem. I can amend that.
Okay. I won't sign those, Alice, until they're amended. Is that okay with everyone? Okay, thank you. Any declarations of interest? Thank you. We've no public questions. We've no town and parish questions. Do we have any questions from councillors? No? Right, we've got the all-age autism strategy to look at, page 9. It's a comprehensive document and takes quite a lot of reading. Is there anything on it that you want to discuss? Sorry?
There's going to be a presentation from Lisa and Jonathan.
Okay. No, we've got some presentations coming forward on it, so thank you, Jyoti.
I don't think it's me, I think it's Lisa.
Hi there. Do you want us to go ahead and present, Beth? Can everybody hear me?
Yes, we can. Thank you.
Yes.
Okay, lovely. Thanks. Hi. Oh, there's the presentation display too. I think Jonathan's just finding the presentation.
Is it not showing on screen? Oh.
No, it was momentarily, Jonathan.
Okay, I'll sharing. Oh no, I see. Yes, sorry.
Come on, my learned assistant.
I do apologise. My IT skills are failing me.
Okay, if I just make a start then. So thanks for having us here today. First of all, I just wanted to send some apologies. Emma Cockerell, DCS in working, was due to attend today. This is an all-age adults and children autism strategy. Emma's unable to join us today, so she does send her apologies. So we'll Jonathan has joined me today to support this presentation, so we'll do our best through. We were also potentially expecting some colleagues from health and ASD Family Help, but I can't see them on the call, so we'll go ahead and do our best to present the slides on their behalf, if that's okay. So if you remember, we last came, it was last summer actually, it was the 16th of July last year. And at that point, we were just launching the consultation in terms of the strategy. So it's been a busy year, and finally our autism strategy has been launched. So we just wanted the opportunity today to update you where we're at and how we plan to progress things. So Jonathan, you're right to take the next slide.
Indeed. This slide really just summarises the content of the autism strategy. As you'll be aware, it was approved last year, but just to rehearse some of the details, it's important to emphasise it's an area strategy, so it's not a council strategy. It's shared between the council and a number of other partner organisations. There are 6 agreed priorities. I'm not going to read through it line by line, but just to give you a kind of broad overview.
Jonathan, we haven't got it on the screen.
You know, I'm still having my technical difficulties. Just a moment. I'm going to switch. It's weird because on my
Jonathan,
end,
can you put it into slideshow? You can see it, but it's quite small.
Yeah.
No, I know. I'm going to stop showing because I've got it showing in slideshow, but for some reason that's not the one you're seeing. I'm going to have to start again. There we go. Is that visible now?
That's showing, yeah.
Right, and that's in proper slide presentation mode. Yes, it looks like it is. So apologies for that, my colleagues. So this sets out 6 ambitions that we are working on in partnership across ourselves, health colleagues, and the voluntary and community sectors. The first of which is around neuro-inclusive communities. That's largely around raising public awareness, encouraging neuro-inclusive practices across partner organisations and a high level of collaboration at a local level. It's about identifying and improving health outcomes. So that's about early intervention and support being available to neurodiverse individuals at every level, and all through the age ranges, as an all-age strategy, as I mentioned. It's about starting well. That's particularly around SEND provision in our education sector in our early years. So we're identifying needs at that earlier stage, and that children and families are getting the right support at the right time to enable them to make the right progress and have good outcomes for their children. Looking at across the rest of this sort of adult age span, we're looking at living well and aging well. So that's about co-developing community support to enable people to live independent and active lives in the community. It's about neuro-inclusive adult social care and about neuro-inclusive housing, so housing suitable for the needs of this community. Also, a major focus of this across our SEND, I mean, I'm here because I co-developed I was involved in developing the SEND and inclusion strategy, and our SEND and inclusion strategy sits alongside our autism strategy. So the next stage is about emotional well-being, mental health and crisis support. Obviously, there's a high level of comorbidity between autism and other mental health difficulties, unfortunately. This is about ensuring that we have the right support in place around early mental health and well-being support, inclusive mental health services, and again, crisis prevention and quick recovery services to wrap around and support individuals to get back on track. And finally, the 6th ambition is around safer communities and the criminal justice system. And again, unfortunately, the neurodiverse people are overrepresented in the criminal justice system. So it's about reducing risks to safety. That's on the one hand, it's about community safety, so addressing bullying and antisocial behaviour, improving protective factors, so that there's a focus on psychosocial education about relationships, about personal relationships and online safety, and about a neuro-inclusive criminal justice system to make sure the justice system itself is well equipped and well prepared to meet the needs of and work with neurodiverse individuals. The strategy itself, we did some work in ensuring it's quite a complex document, so we've ensured it's available in a number of different formats. So we've got an easy read version, the summary one-page version, which is what I was just sharing with you, and then the full strategy. So there's a number of resources online to help various, different members of the community and different stakeholders to be able to access and understand what's in the document. And we put some effort into that. So those are all available there at that web page. The Autism Partnership itself is made up of a wide number of different organisations. We've got Send Voices, our parent carer forum, Promise Inclusion, ASD Family Help, Autism Berkshire, and CLASP. Now, these are representative organisations. There's actually a wider body of other agencies out there working with and supporting families and children with autism, but these are the representative groups that sit on our Autism Joint Planning Group. That's, if you like, the coordinating body that oversees the delivery of the strategy, and we meet fairly regularly to oversee implementation and focus on moving things forward. Probably one of the first things that joint planning group did once the strategy had been approved was to work together on putting together an annual event, which took place in, I think there's more slides on that in a moment, so I won't dwell on that right now. So it's about working with other so that those representative bodies are there to network with and engage with other advocacy groups that are out there across Berkshire, meeting the needs of local people. And about other not autism specific, but other wider range of other community organisations who also may be able to contribute and support with this agenda. And also that group oversees the sort of a newsletter, getting their communication out more widely to a wider range of stakeholders so people can be kept abreast of developments locally. And there's a real focus on this whole agenda around co-creation. So it's about working with and alongside neurodiverse individuals, whether they have a diagnosis or not, whether they are self-identifying as having autism or other neurodiversity. So it's not prescriptive in terms of being label-led or diagnostically led. It's more about self-identification of those needs. I think I'm handing over to you on this one, Lisa, because I'm afraid I wasn't at the event, but I know you were. So. Well,
I was, and it was a really fantastic event, actually. So it was the Working World Autism Awareness Day on the 2nd of April, and we used that day as an opportunity to launch our strategy. So over 200 people came to the event, which was absolutely fantastic because a huge proportion of those individuals that came aren't people that are necessarily known to all of our services. What we were trying to do is a wider reach to individuals, and it was a real opportunity for all of our charities and all of our services to get together. We had lots and lots of tables, as you can see, with people providing information and advice and support. We had our charities working together with adult social care and our children's services. So it was a really nice opportunity as a one-stop shop for people to come in and gather information in that area. We also provided a number of practical workshops on the day as well, around neurodiversity, what it is, communication skills. Our ASD Family Help provided a workshop on that. Autism Berkshire did a workshop about sensory differences, supporting people around understanding that and how it impacts on individuals. And there was also some sensory support there from the NHS. So it was a really well received event, and it felt like a really nice opportunity for us sort of to kickstart our autism strategy. And the next slide just shows our logo. And this was a competition that was run on the day, actually. And a young lady called Beth designed this, a lady with an autistic young person. And out of lots of different people, she's designed this. So this is what we are running with in terms of our partnership logo, which we're very, very proud of. So in terms of next steps for us, as Jonathan said, the ambitions in the autism strategy are really vast. There's no doubt about it. It's across children's services, adult services, health, voluntary services, charities. So we know that our ambitions have got to be achievable and measurable. So the Autism Joint Planning Group have decided that it would be best for us to concentrate on one ambition first. That doesn't mean that we won't be looking at the other ambitions also, but for the focus of 25-26, the partnership have decided that they will look on ambition 1, which is about neuro-inclusive communities. And as you can see, the key areas in that are about raising public awareness of autism and neurodiversity. It's really looking at neuro-inclusive practices across adult social care, across children's services, across our health colleagues and voluntary and charities, so that we are all working in a way which is accessible for our people who are neurodiverse. And it's also about collaborating locally with our local services and businesses, community groups, so that we can enhance opportunities for people with neurodiversity in the community. So we've just got a couple of examples here of the sort of things that we're doing. We go on to the next slide. So we are offering training to adult social care teams at the moment. So we have commissioned some bespoke training, and that has been delivered by some autism champions. So they are delivered by people with lived experience to professionals, to different groups that we're working with. Over 60 colleagues have taken part in this training so far, which is really, really positive. And they've done things that, you know, what we think is our bread and butter, actually, how to carry out a Care Act assessment, how to support with people with neurodiversity, how to identify mental health conditions alongside their neurodiversity, and how to adapt the practices. So we have, you know, accepted that there is work to be done with our adult social care teams, with our children's teams, so that we can do things better. And that's a really good thing that is coming out of this already. We were hoping that our health colleagues were going to be here today, so that we could talk through the neuro inclusion passport. And essentially that's something that has been designed to provide adjustments if people are attending hospital appointments, GP appointments, etc., and how we can reduce external factors which are creating anxiety for those individuals, and how we can support them better in all the services that we're receiving. And also, we were hoping that Kathy was going to be here from ASD Family Help. He was going to talk about the Safe for Me project. And this is a really nice example at how we are working on some of the other ambitions. This focuses on the 6th ambition, which is looking at our safer communities and criminal justice system. So this is a match-funded project between WBC Adult Social Care and the Woking Community Safety Partnership, and it's a grant funded by the Police and Crime Commissioner. It's aimed at 15 to 19-year-olds, and it's a project to basically support neurodivergent people, to support psychosocial education and relationships, to look at online safety, concerns about them in the community. And it's a really nice collaborative project to help young people who are neurodivergent feel safe in the community. So they're just some examples of the sorts of things that we're doing. We just wanted to emphasise really that we want to co-produce all our projects. We want people who have lived experience to be involved in everything that we are doing, and they are going to shape the future of how this strategy progresses over the next 12 months and further. One example of that is during our event. We started looking at the website, and we started gleaning people's views about what they wanted to change. How can it be more accessible? What information do people with neurodiversity need, etc. So, and then we are taking that information that they provided with, we are going to go into smaller groups and get people with lived experience to come and talk to us about how we can do things better. So we are really clear that this is such an ambitious project that we do need to measure success. We've got some ideas of how we're going to do that, which we can see on the screen there. But we are really going to be using that Autism Joint Planning Group to help us define what we are measuring and how we are measuring, and where we need to be reporting back to. So just the final slide is to say that, you know, there is a lot of work going on in the background. We do know that we need to be quite transparent about what we're doing. We need to think about ways that we are feeding back to people in our community. We know that we're already looking forward to our event next year, that we will publicly feedback on the process of what we achieve within the next 12 months. We're going to continue with our bi-monthly autism joint planning group. And if there's any more information that's needed in the meantime, then please do call on us. If anybody has any questions, we will do our best to answer them.
Thank you very much. That was a very full presentation on top of the information we've already got before us. Do we have questions? Alison?
Thank you very much for your presentation. It is a brilliant strategy. It's good to hear how things have got started, and I know as a committee we'll be keen to see year on year the progress of achieving all the targets. The Safe for Me project very much interested me. I saw it was May to September. So could you tell us a little bit more about, you know, have you had 15 young people take up all the places?
So I'm not sure on some of the detail on that, if I'm being entirely honest. We were expecting for Kathy to be here to give a lot more detail on that, but I'm really happy for us to send some information over, if that's helpful, about some of the detail of what we've achieved already on that. That might be quite helpful.
Yeah, that'd be great. Thank you.
Okay, we're happy to do that. Sorry that she wasn't here.
Rebecca?
Similar, I don't think you're going to be able to answer this, because it's the health people I was really wanting to speak to about the passport and how you're going to be working to integrate that, because it's a great idea, but how do you get anybody at the hospital to actually even, you know, look at that before they go there? I just know that things are so not joined up within the NHS. You can have one bit of paper with something filled in and all about you, and then you walk into an appointment and, you know, you've got 5-10 minutes and nobody even bothers to look at your theoretical passport. But I don't suppose you can answer that.
No, I wouldn't like to incorrectly answer on their behalf, Rebecca. I think you're absolutely right, though. I think theoretically this is an excellent thing, and I think everybody's committed to the idea. You know, we've had people with neurodiversity involved in this, bringing it together, but it is about how that works in practice, isn't it? And whether we've got the right organisations across health, because there are so many involved at the right bits. But perhaps, again, would it be helpful if I get some more information about that and pass that back? Yeah,
that would be good, because it's just, you know, from we all have our own experiences of, you know, hospitals and various things, and you just know you go one place and they have no idea about anything, and you start from scratch, and it's quite a big document. So
it is, and things change quickly for individuals as well, don't they?
So I'm just wondering how it actually will work on the ground.
I will get some information, Rebecca, and pass it back.
Thank you. Siona?
Yeah, I was just also wondering about the passport. How do people get them? How are they issued?
The aim is that they will be available through the hospitals, through RBH FT, through the ICB. So it's meant to be that all touch points within the health system, that all those professionals will be aware of them, and individuals will therefore be supporting people to complete and access them. But it's a big ask, isn't it?
So is that going just across Berks, Bucks and Oxfordshire? Is this nationwide?
This is the Bob footprint, I believe, in terms of this document.
So for my ward, we use Frimley, so that's hospital, Frimley Park Hospital, which isn't in the same trust. So they don't have access to it then?
Jonathan, I can see your mouth moving.
No, well, I was. It's not really an answer, but it's an observation, which is that the Bob ICB and the Frimley one are in the process of merging and coming together. Yeah. So I'm imagining that some of these positive features like this, I mean, it may well be that it does exist in Frimley. I can't speak for them, but I would imagine we'll be integrating some of those things to cover that wider patch. But there's a huge period of change and upheaval at the moment in the ICB, not with the providers so much, but with the ICB. So which may be why he's been struggling to attend this evening. But we will certainly be able to report back as to whether the passport will be a feature across both areas in future.
Yeah, and I know they've been speaking to dentistry and mental health services as well. So it's vast and broad. So it would be helpful, I think, to provide more detail around that.
Any more questions? Can I ask how you've involved education in this? Because in both primary and secondary schools, we come across a lot of neurodiverse children these days. Have they been involved in the work that you've already done? If not, how are they going to be involved?
Schools are very much involved. I mean, a lot of the work, this is where there's a kind of overlap between the SEND and inclusion work and the specifically work on autism. But there was certainly a number of big initiatives coming into schools. We've got a big project. It's a health-led project called PINS. I'm going to struggle to remember the acronym now. It's about improving schools' ability to identify and work with neurodiversity. It's a national programme. We've just had 32 of our local primary schools sign up. The programme is just getting going, I think, in Wokingham. But we'd expect in most areas they have half the schools do it in the year 1, and then in year 2 they roll it out to the remainder. So we're at the early stages of that, but that's very much about equipping schools with the latest and the best practice in terms of working with neurodiversity. That's a national programme. At the local level, there's recognition, I think, in our local system that the waiting lists for diagnosis are far too long, and there's a big piece of work underway across Berkshire as a whole, looking at our neurodiverse, the neuro-inclusivity of our whole system, really, particularly with schools. And schools are very much engaged in that piece of work. There's a real appetite from schools to ensure that, whilst there may be long waiting lists, ensuring that we're offering the best support we can to families and young people who are neurodiverse. And there's a real high level of interest in this. It's such a prevalent issue in schools, as you're well aware. I mean, 40% of our education, health and care plans are for autism. So, you know, it's a major issue in the local school system, and schools are certainly, I mean, they're improving. They've got some really excellent practice in our local schools, but we're ensuring the consistency of that is more, that every school, you know, operates by the same standards and offers the same level of support. But there's lots underway in the school sector.
Thank you. Any more? Maggie?
Hi, thank you for the presentation. I have a question on similar lines. What are the measures that are going into encouraging more professionals to enter into schools, especially primary schools, to support children with specific needs?
I mean, our measures, there are a number of different measures. In terms of impact, I should have a ready answer for this. I mean, in terms of one of the things we focus on is identification of need and ensuring earlier identification of need. So in schools, that would be at SEND support level, which is the tier below education, health and care plan level. We are really working with schools on consistency across the system. Just last week, we launched a new document called our Ordinarily Available Provision Offer. It's a really excellent resource we've developed locally in partnership with schools, and that sets expectations. Because we've now got that consistent document, it's easier then to historically it's been very much down to individual school decisions about quite what they offer in that area in terms of early intervention. But now that we've got that widely agreed consistent framework, it'll become easier to then to if you like, to judge practice and identify where there are gaps and identify which schools need a bit more support in terms of getting up to speed. We have a lot of different, I mean, our autism specific outreach offer is from, well, it was Addington School, it's now the Ascendancy Trust. We commission them to offer quite a broad-based outreach offer to all our mainstream schools who can access real expert help and support on this particular area, and that's the uptake of that has been increasing in recent years. So we know there is expert support and help available for our mainstream schools. So a lot of investment and attention has been going into this area. The measures, the crude measure would be how many children are identified with autism at SEND support level. We keep a very close eye on that, and we'd expect to see that probably increasing. Our EHC levels are as expected or even slightly above it as we would expect to see. But at SEND support, which is the earlier stage of intervention, we're hoping to see increases there, because you know, that's where you really want the intervention to happen at that earlier stage rather than late on.
Thanks for the answer. On similar lines, where the identification process is taking longer than expected, and while the kids lose precious time, once the identification is done, what sort of measures are being put in place so that they can regain the lost time or to get them up to speed? Yeah.
In terms of the education support and the system, we do not wait for that formal diagnosis, because that's such a long, you know, the waiting lists are extraordinary and not where any of us would want them to be. But we therefore, most of our policies in terms of educational support are not reliant on a formal diagnosis. You can be on the pathway, you can be at a very early stage. The school can still receive an abundance of support and advice and guidance in terms of how to get alongside that child and meet needs. And even for an education, health and care plan, you wouldn't need to have a formal diagnosis to be able to receive an education, health and care plan. And the evidence is there. We have, as I say, we have a significant 40% of our EHC plans are for autism locally. So and that's higher than average. So I think our rate of identification, rate of identification at that high level of need is actually above where it should be, and I think that's partly a fallout from the fact that we don't identify need at an earlier stage. That's what we're mainly focused on at the moment, is improving that early help and early support to families through schools. And as I say, we have some excellent provision locally. We have Assist, who are there to support families. And again, you can't self-refer to that service, but we, through the schools and through health colleagues, families can be referred to receive really good level expert guidance from that service there. So there are a number of others, but I mean, it's not necessarily that we're short of the provision. What we're trying to focus on now is ensuring that the families that need it get access to that help.
Alison.
So, you know, we all want this borough to be a neuro-inclusive community, that people who are autistic or neurodiverse are accepted for who they are. You know, they're welcomed and they're part of our community. And the first ambition of raising public awareness to enhance understanding of autism and neurodiversity is very important. You know, some people, they haven't had somebody in their family, they haven't had a friend, they don't have any direct understanding where they've learned more about these things. And in the summary of Raise Public Awareness, was talking about awareness of support, signposting to services, but what I don't understand is that raising public awareness and enhancing understanding, how we're achieving that.
So I think that by holding events, so we're doing a number of events at the moment where we are trying to get out into the community a lot more. We just, the event that we held back in April, we've just been to one with some of the schools very, very recently. So we're trying to be present, make sure that people are aware of the strategy, make them aware of the services which are available, and use that as opportunities to seek people's feedback and support around what's happening in our communities. And also we are doing an awful lot of work around our website right now. So people with neurodiverse conditions are supporting us about what to put on the website, so that we've got regular comms going out of different events which are happening, or things that we might want to be co-producing with them. So it's going to be a case of slowly, I think, just trying to get out there and do what we can and be very present within our communities.
So could you give me some examples of the events you've been at this summer?
Yes, I'm just going to look up. Just bear with me. There was an event we went to a couple of weekends ago. I wasn't there, so I'm just bear with me. If you prefer to move on, I can happily get you that. if Sophie had been there, who was our lead, she would have had all of this. You allow me to send you the information of what we've attended.
Okay, thank you, Lisa. I think you have been put on
Yeah.
the spot a bit by lack of support from your colleagues.
No, I'm sorry, we haven't got all the information at our fingertips, so I will send that all over to you.
Thank you for doing that. This is the first time we've been through this in this format, and I think we'll need to bring it before the committee again to see how things are going, to see that you're contacting and having contact with the schools in all the towns and parishes in the borough, as well as in Wokingham. Is a year too long or too soon for you to be doing a review?
I think we'd thought a year just because the cogs, there is a lot involved in it. We're really happy to come back after 6 months if that's helpful. I think sometimes to give an idea of where we're at. If we're moving quick enough, we need to be moving quicker. So I think I actually would feel more comfortable with 6 months, really. If that's happy to.
Will you have sufficient data to demonstrate? You know, you said about measuring success. To measure it, we need specific, actual figures and data.
We should certainly have some data within that time period in terms of how people are accessing training, etc., and groups that we're reaching out to. So at the very least, an update of where we're moving to. A year feels a long time, doesn't it? It's entirely up to you.
Let's say.
Yes, I mean, if I may come in, I mean, certainly in terms of there's so much activity in education, we can certainly come up with happy to come up with a more detailed report in terms of level of uptake, level of identification of needs, some of the trends around that. I mean, that can get very techie, but I'm happy to come back with more of those measures and how we measure that, because obviously in the world of SEND, where there's so much reporting back to the DFE, we can certainly bring more detail if that's what you'd like to see.
That would be very useful, but we'd like to know what difference you're making to children's lives as well. So those facts as well.
Yeah, absolutely, Beth. I think it's really important because we've only just started working with the group about how are we going to show that we're making an impact here, because it's all very well having a strategy, isn't it? But we have to be able to measure the success. So we've started those conversations. So even if we haven't got all the hard facts, we will have some, but it would be good to show you what we're measuring, because it will be more than three boxes, which is we presented to you today. So I think that would be good for you to show, for us to be able to show what we're doing in this arena.
Yeah, if we can leave you to work that out with Madeline when it actually comes to the committee, to fit in with our forward programme and what you're doing, that would be good.
Of course.
So thank you very much for bringing the strategy to us. It was lovely to see Imogen in there, doing her little bit for you as well.
In the photos, yes.
Yeah. Thank you very much.
All.
Thank you. Have the rest of your evenings peaceful.
Thank you.
I think I'm remaining for another item, Beth. I'll stay quiet for a while.
Yeah. Sucker for punishment, Lisa. Okay, the next item on the agenda, if I put my glasses on, I think is page 39, Adult Social Services KPI. That's right, is it? Or have I missed something?
No, that's right.
Yeah.
Lisa and Lorna.
I stayed quiet for all of 20 seconds. I'm really sorry.
Yeah.
Okay, it only feels like a heartbeat since we were here last time actually presenting our KPIs. So we just wanted to give you a bit of a brief update of what we've been doing within the last 3 months since we were here last. So I guess a couple of our top wins or successes is Bluebell House. So I think we've given regular updates about our residential home, Bluebell House, and we are continuing to increase our occupancy there, which is really, really encouraging in terms of what we can offer to our community, and it's supporting us with management around our costs, It's supporting us with discharge from hospital. And the most important thing is that we are getting some absolutely lovely feedback in terms of the service that is provided there. We're really, really proud of the service that's happening at Bluebell now. Alongside that, we've also purchased another care home, the Hollies. I think we had just done that the last time we were here. So that is a 58-bedroom care home over in Burfield Common. So we are working very, very closely with Optalis at the moment to build that up and to start filling that home up, which again will be really, really great in terms of managing what we know is a very, very difficult area. So we had our CQC visit back in March. So since then, we've been sort of thanking everybody involved for what they did. We are still waiting to hear back from CQC about that. In terms of the collaboration, the corroboration through the panels that they have. So we're hoping to hear back from them very soon. It's a very long process, we've been informed. Social Care Future, continuing to embed that. We are doing an awful lot across adult social care in terms of projects, but more importantly, we've been embedding that across our corporate colleagues as well. We're doing a lot of work around some of the assets that we have, making sure that the places are accessible, that the toilets are big enough, only because they look big enough on a map. In reality, that hasn't been the case for people with wheelchairs and needing to access those provisions. So it's enabling us to build on that and create a much better offer for people. Another of our wins was about launching the autism strategy, but I will not dwell on that. I think we've talked previously about our residents reception, which continues to grow legs. We are going out every month with our charity partners into the community so that we can go directly to people. It's a one-stop shop where people that often don't engage with services can come and see us, ask for information directly, and we can offer them support on the stop. So there's a lot going on. I think Lorna would agree that life is busy at the moment. Referral rates are going up. Complexity seems to be increasing without a doubt. But despite that, I think you'll be able to see from the report, we're hanging in there by our fingernails. So please do ask any questions if you've got any to ask.
Rebecca.
I was interested in the one about the admissions to nursing homes and how you managed in one quarter to halve it. So obviously you hadn't even gone red to amber, you went from red to green.
Yeah.
So was this just I'm not trying to say, was it a bit of luck?
No.
Or how did you actually manage that? Because it's quite a considerable drop. Yeah,
it was luck. It was luck. We've done all the unpicking of that because actually it was it was the last quarter, so it was a period which is normally incredibly busy, but for some reason the numbers went down. We would like to propose that we did an amazing job of getting people into extra care and everything else, but actually when we've unpicked it, it was just an unusually quieter period. We have seen those numbers starting to rise again. So I think it was nothing more than a blip, but and one perhaps that we can't take an awful lot of credit for.
Yeah, I was wondering if maybe, there was something new that had happened or a new initiative, but sadly it was just literally a blip, and you probably go back to red or at least amber in the next quarter, which is a real shame, isn't it? It's not like you could look at it and say lessons learned and, this has worked.
Believe me, I was there with my pom-poms trying to unpick it, thinking we'd cracked it, but not on this occasion. We are doing a lot of work around extra care as well, looking at how we can enhance that offer so that residential is not our fallback if somebody has incredibly high needs. So we are still unpicking that and looking at how we can support within that sphere as well. So we haven't given up.
It's
but
just
we
so
do
difficult,
anticipate it will rise.
isn't it? Because there does come a point where the reality is, you know, to be able to provide the care that you would receive in a nursing home is incredibly difficult with it at home. You know, you know, I know from supporting a local friend and her husband, and you know, despite trying to do everything possible to keep somebody at home, it just gets to a point where it's not manageable, even with carers coming in, because they can only do 15-minute slots, and you know, it just gets to a point where. So it's very hard, and with an ageing population, you know, this target is incredibly hard to manage, isn't it?
It is, and I think, yeah, so there are the two things there. Once we think we've got an unreasonable target there, we have talked about changing it, but there is something within us that wants to keep being able to strive for that and not to keep, you know, making that increase. But I think at some point we will have to revisit that. And you're absolutely right. It's about having something which is safe and sustainable at home. And whilst we want to keep people in their homes for as long as possible, at some points it becomes something which we can't sign off on, because we know that there are huge risks associated with somebody remaining in their home, and we know as a local authority we are duty bound to make sure that the packages that we are putting in and approving, they have to be safe and sustainable. So with the ageing population and the stats that we are able to evidence in terms of how that is growing, how packages of support are growing all the time, it's becoming harder and harder.
Yeah. Okay, thanks.
Any questions anymore? Can I ask Lisa about the work in the community? Are all those things happening in Wokingham, or are they happening across the towns and villages that make up the borough? So have you had events and things in Woodley and Earley?
In terms of what, Beth? Which events are we talking about?
In terms of the launch of the resident receptions.
Okay, yes. So what we've done is we have identified, based on population health management data, which areas in the Wokingham Borough have the highest areas of deprivation, etc. And we have targeted 4 areas that we are going out to. Now we are looking to expand that model. We've started with 4 areas that we've targeted, and we go out, it's like a roving bus, and we go out with our colleagues from our charities and voluntary services, and we just have a plethora of information which is available to them, and it's something we're growing. We're having conversations all the time about community hubs and how that model might fit into that as well. And I think, as I'm sure of you all know, there's a lot of talk about integrated neighbourhoods as well with health. So we're starting to have those conversations with our colleagues about how we are working together to be reaching out to people more readily within our community. So it's an evolving model.
That's lovely, so long as we're being inclusive of all our communities, and I realise that's not the easiest thing to do. What are the occupancy levels of Bluebell and the Hollies currently?
So
I thought Bluebell was about full.
It is. So I'm going to say, Lorna, off the top of my head, 52 places there, 52, 55.
At Bluebell, it's around, it's low 50s.
Yeah, and we're almost there, Beth. So it's been a case of taking it over, improving the quality, which we've definitely done, refurbishing it alongside trying to increase occupancy whilst doing each of the rooms. So I think we're there, bar a few rooms now.
I have to say, from my visits there, the atmosphere is lovely.
Lovely, isn't
and the staff are really, really kind, really generous with their time. But the atmosphere is really nice. If anyone hasn't been, it's worth going to have a look.
It's really nice. And our ambition is that Hollies will follow in that footstep. So we've obviously taken that over. The The first bit has been about getting in that understanding it. We haven't been taking any new referrals because we, Optalis as a provider, have wanted to understand who they're working with and look at building up that model. We've got lots of refurbs to do. So once again, it will be a case of balancing the refurbishment with growing the number of people that will be going into the Hollies. So we're fingers crossed it will be another really nice home.
The refurb at Hollies is very active. I mean, I was there last week for a day, and about half of the upper floor is currently undergoing refurbishment, and then obviously they'll move around the building. So it's a hive of activity, and like Lisa says, I think, you know, we will anticipate 6 to 12 months being able to go in there and see a similar atmosphere to the one we've got at Bluebell now. I've been in and out of Bluebell over the last 10 years, and I would say it's unrecognisable now from a couple of years ago. So it's absolutely fantastic to see it.
Thank you. That's lovely to hear for us as well. Any more questions? Thank you very much. We'll move on once again.
Thank you very much.
Thank you.
Oh, sorry, I turned it off instead of on. We've got a paper on our desk from Health Watch. I know those of you that will have heard the news on the TV and radio recently said they're talking about getting rid of Health Watch. This is coming from Alice. This is the latest position that she knows. She's not with us online tonight. Is she? Oh, she is. I thought we'd miss you, Alice, if you weren't here anyway. And Alice, do you want to talk to that and tell us what's going on, not only with you, but with the government?
Well, so just to share with you, we've all gone through a roller coaster. I mean, this is 153 health watches, including Health Watch England as well. So we've been going through a roller coaster ride since the 27th of June. About the future of Health Watch England and the local Health Watch. So if I can share some my presentation, hopefully you can see my presentation.
Yes, we can.
So I can't see y'all, so please tell me if there are any hands out there. So what had happened is this news came out on the 27th of June. Apparently the Daily Mail was going to put out a news saying that Health Watch was closing, and so Health Watch England called all of us in at 5 o'clock in the evening on the 27th, which is a Friday. So the news dump it was. Actually, the scenario is a cart before the horse. As we were waiting for a DASH report, so the government asked the CQC to be reviewed, and which also included Health Watch. And with the launch of the NHS plan, the Labour government announced that it wanted to change the law to transferring the work of Health Watch England to the Department of Health and Social Care, and also transferring the work of local Health Watch services to the Integrated Care Board and local authorities. So how it works is anything to do with health will go to the Integrated Care Board, and anything to do with social care will go to the local government. So the government has now accepted the recommendations of the DASH review, which came out yesterday, and will pass legislation to enable it when time allows. So which means until legislation is passed, the Department of Health and Social Care will advise local authorities to continue commissioning local health watch services. So the recent coverage in advance of the DASH review may have given some communities and stakeholders the impression that our closure is imminent. It's not. So the Department of Health will need to clarify when and how any transfer of Health Watch function will occur. and then we will be encouraging them to answer these questions as soon as possible. In the meantime, we will continue to gather, analyze, and communicate people's care experience and provide advice accordingly. So Health Watch has not gone away at all. Please be assured of that. I know some people may think that they'll be disappointed, but they're not. We are not going away. We will still continue our functions and share whatever we feel is the required need to hear the voice of the community. So to date, our functions remain the same, and we will provide listening, advocacy, and signposting. So we will continue with our launch, which we are having on the 16th of July, whereby you will hear our annual report and all the impacts that the annual report has managed to do for the community of Wokingham. The concern that we have is going forward is how the public voice is going to be heard, and equally the loss of independence as when the function of Health Watch goes in-house, which makes them, it's like marking your own work. So that is what I wanted to share as such. So please be assured that from what we have heard, the earliest we will know might be October 2026.
Thank you, Alice. At least we've still got time to work together and see when time allows the government to do it, whatever they choose to do. Any questions? Sorry, Alice.
No, the thing is, though, I think a lot of this is the issue. I think everyone is worried about is about the independent voice. So there are loads of health watchers are now all coming together to do a campaign to try and see whether they can change the government's thought process.
Lovely, thank you. Any questions for Alice? You've got away lightly tonight, then. Thank you, Alice. Is there anything that you need to tell us that we haven't asked you?
No, I mean, apart from, I hope you all have read the annual report and, and understood that there's lots to celebrate. From the annual report, there has been a lot of impact, and we will also showcase that as well on the 16th, because I do think that the voice of the public are heard through Health Watch, to be honest.
Okay, lovely. Thank you, Alice. Next item on the agenda is the forward programme on page 55.
Okay, so September we've got a update on adult safeguarding. Last meeting you asked for further update on the coroner's service, so hopefully we've got that scheduled for that meeting. Social Care's future are coming back to update on the progress that they've made. We've also suggested that, I appreciate it's not on the forward programme since it's been published, that we have the public health KPIs for the committee to consider. And then for the November meeting, we've got take off public health KPIs, and we've got the adults KPIs, GP performance and Health Watch. From your discussions tonight, regarding the all-age autism strategy, if you wanted an update within 6 months, we could have something on the January meeting, if it worked for timescales.
I do think a year would be better. I mean, if you read their paper, they said they hadn't decided on the measures yet. They would discuss them this summer.
Okay.
And then they were going to be presenting them at, in April to the community. So I think having it after that event in April would be best.
Okay, I can put that on as unscheduled with a note, essentially, that we're looking at a year's time. Sorry, Councillor Margetts.
My email about Westmead, why it was removed from the agenda as it wasn't a public item yet. People are fully aware of it.
Sorry.
So what is happening about that?
Again, suggest that's for September. Apologies, I've missed that one off.
We haven't got anything on about dentistry either in this coming forward programme.
No, and just to quickly touch on the topics which are unscheduled, just seeking an update with public health as to the most appropriate time for the public health strategy to come in, because obviously some of our later meetings are less populated than the coming ones. I would suggest that you wouldn't necessarily want to have anything further for September's meeting, unless obviously you want to remove one of the items. Sorry, Councillor Swaddle.
So in the email I received from you on the 2nd of July, when I asked why we weren't looking at public health KPIs, you said we would have to leave it to the next meeting because key members of the team would then be present. So we do have and still have our public health Director of Public Health, is that the position, with us tonight. Who are the other key members of the team who would attend to answer questions?
Shall I answer that? Yeah. So I think that when we come to committee, you will probably be interested in our 0 to 5's performance. I think that's what will pique your interest. The reason I've asked for it to be deferred to the next meeting is because I can then have my 0 to my children's lead with me, but also to have a representative from the service there with us to support with answering questions.
So we are going to be looking at statistics about January, February, March in September. I mean, it's getting quite old by then, isn't it?
You'll have the latest data, the latest quarter we have available to us. We often have a bit of a lag with our data because we need the whole quarter to close. So for example, for smoking, it takes a 12-week program to complete a quit attempt. And so there's often a bit of a lag with our data.
So at the end, the final month of Q2, we're going to be looking at the Q4 stats. So yeah, I understand what you're saying, but we are well behind on looking at them. But it makes more sense to have people. I think it was demonstrated by the all-age autism strategy that if we haven't got people here who can answer the questions, it's a shame that the councillors are here to ask them. So we really do need to have people come to committee. And we would always appreciate people attending in person. I don't quite understand why we are very rarely having officers here anymore.
Oh, sorry, it isn't something that we'd spoken about since COVID, so we can certainly look at having officers here like we used to do in the past. We'll talk about that, Alison.
So in terms of the later meetings in the municipal year, was there any other items that members had in mind that they would like to look at that you're aware of at this stage?
As I said, I'd like us to put dentistry on.
Yes, and also looking at the action tracker, I would just highlight as well that we will have the, bear with me so I get the name exactly right, the alcohol, tobacco and vaping needs assessment is it's currently scheduled as autumn because we're not quite sure when that will be ready. So members had asked to look at that when that was available.
So, to my mind, everything on the tracker that says to be scheduled should be listed as a bullet point in currently unscheduled topics.
No problem, I can update that.
And we would then have rather a large list, which we need to fit into November, January and March. I'm sure the chairman's got suggestions on how we're going to achieve that.
I think we'll need to take that off offline and come back to you. Yes, I think you're right.
That's what you said last meeting.
What I said?
The last meeting, you said you would come back to us in an email with a proposed forward plan because we weren't able. The plan we had just had, you know, the statutory, well, standing items, Health Watch, and the KPIs. Rather than trying to fit together all of the unscheduled topics, because we know it's hard work for Madeline trying to get people to commit to coming to these meetings, so it has to be done well ahead of time. But it's no good us suggesting that people come to November or January.
No, my apologies then, I hadn't picked it up with Madeline. I will do. We'll do it this week. Anything else? Sorry, Nuggie.
Can we add something on the waiting list at all? Yeah. Yes.
Waiting list for the hospital, you mean?
Yes, please. Yeah. I have one more thing as well. With the SIL funding or Section 106, I was reviewing the numbers and I think there is some pot for healthcare facilities. Just keen to know what are the plans for it. Yeah.
Are we due for an update from the ambulance service?
We can certainly ask for one.
May as well. Okay. Thank you very much. That concludes all we have on the agenda. We can all go home in daylight. It's still nice, isn't it?